Certain things you can't put up in the house, because if you put them up, you know that when Alex passed through, is like a weapon of mass destruction. Welcome back to our channel, and thank you once again for joining us in this another day in the life of living on Autistic Edge. I am Terry Ann Elaine, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on Autistic Edge. Today we want to talk about magnesium and how it helps ADHD. Now, individuals with ADHD often faces a unique set of challenges. You have difficulty with focus and attention, inappropriate outbursts, and there's the emotional regulation that results in some explosive reactions, meltdowns, environmental stimuli that triggers some very strong response. This neurological condition affects every aspect of life. It affects the life of the children on the spectrum or with ADHD. It affects the parents. It affects caregivers, because if it becomes very overwhelming for the caregivers to take care of these children, they will eventually leave. It affects teachers as well, because if the class continues to be very disruptive, it affects the learning process, not only for that child, but for other children in the class. It affects extended family members. It affects even your relationship with others. So ADHD affects every aspect of our lives, and especially for those with ADHD or those on the autism spectrum. Some studies have suggested that magnesium supplementation can have a positive impact on ADHD symptoms. For us, we went quite a few years with minimal sleep. And when I say minimal sleep, minimal or sometimes none at all. Most nights we get 1 to 2 hours sleep. If we get 3 and 4 is very few and far between, because our child suffers a lot with insomnia. And for you autistic parents out there, you know what I'm talking about, right? Public disturbances and embarrassment with ADHD behavior. When we go out in public and Alex decide to throw a fit and have a meltdown because of whatever stimuli that is in the environment or whatever it is that is coming at him. Not being able to attend some functions because the crowd might affect him. There might be light, there might be noise, and other stimuli, you name it. We don't visit some persons, and that is because, whether it be family or friends, and that is because of either their lack of understanding, their lack of support, or even appreciation for the behavior that our child may display. Sometimes we even don't attend church because it can be overwhelming at times. Sometimes you are just so tired, and when we go to church, half the time or even 3/4 of the time is being spent outside, chasing him around the church or running around, just enjoying the out of doors, because whatever is happening inside may just not be interesting for them. These are just a few of some of the moments that we have gone through with our child who is on the autism spectrum and also ADHD. We got to a point where we were so overwhelmed. We never thought that we would make it for much longer. And it's like, hey, we talk to God about this all the time, and we say we need a breakthrough. We needed to have some sense of normalcy around our home, or else somebody's going to have a breakdown. So we met up on an article that refers to magnesium and its benefits. So we discovered that there were many different types of magnesium. All right. So magnesium supports brain function. It also calms the nervous system. And when it calms the nervous system, it helps to reduce anxiety, irritability, and it also reduces this sensory overload that is often seen in autism patients. Now, what we also find is that magnesium helps to improve the sleep, so it gives you a better quality of sleep, and it also reduces hyperactivity and also to improve attention. So those were some of the benefits that we discovered about magnesium. We uses a liquid magnesium known as Calmify. This is the one that we use, right? Here we have the box might give it. This is what the box looks like. All right. So this is a liquid magnesium, and it's made up of magnesium glycinate and magnesium citrate. And it also have a little bit of the L-theanine as well. Now we have also discovered magnesium L-threonate, and this is what it looks like. Now the L-threonate, it helps with sleep efficiency. It supports the nerve and the muscle function, brain and cognitive health. All right. So these are the ones that we use. Now, magnesium glycinate and citrate and malate, we found that those were the recommended ones because they were better in terms of absorption, right? L-threonate was the one that crosses the blood-brain barrier. Now for us, we added vitamin B9 and B12, all right, in the form of this, and this is the methylated version. We added B9, if you can see this one. I'm going to put it up there on the screen if you're not able to read. All right, so B9 is a form of folate or folic acid. Now, in our early stage of pregnancy, for most pregnant women, your doctor would have recommended the folic acid that was good for the development of the brain function. And of course, the B line of vitamin is always good for our body function. Now, and I'm going to drop a link below for the ones that we use, and you can do some more research on them. Now, let me tell you what our results were. After we started using the magnesium, especially, we find that we no longer had use for the melatonin. We use the melatonin to help aid sleep because of the insomnia situation that we had. We had him on melatonin for quite a while. There are days when the melatonin works. There are some days when it seems as if his body just get used to it and it just don't work. And you went through a full night, probably you get half hour sleep. All right. But now we pulled him from the melatonin and we have him on the magnesium. Now he goes to bed even by himself. We find that we are now able to go to more places and have less problem behaviors. Recently, we went to 2 funerals with Alex Xavier. And can I tell you, it was a long trip and a long day. Alex sat through the entire service. He went outside for snack and he went to use the bathroom and he came back in and he sat through the entire funeral. We were very surprised. When we got to the graveside, Alex was just by my side throughout the funeral. No meltdown, no problem behavior. He was just pretty much calm. And of course, he took his magnesium that day before we started the trip. We had far less meltdown. That was another benefit that we have since we started using the magnesium. And as a matter of fact, for the past 6 months, we have had only one major meltdown. And that meltdown was as a result of him having the flu, and we were giving him one of those cold medicine, and it created some anxiety, and I think it was a little overwhelming for him, and he got into a meltdown. Now, thank you so much for having supportive doctors, because we reached out to our doctor and immediately, we were able to have a quick discussion in terms of what changes, and we realized that this particular cold medicine had created some anxiety. So with discussion and dialogue with our doctor, we pulled that medicine, replaced it with another cough medicine, increased the magnesium, and then within a day, he was more back to normal. still have some anxiety, but it was manageable. We are now able to sit in church for longer hours. Now, it was a breather, of course, to be able to be having these pleasant experiences, because on a normal basis what we used to have is when we go to church with him, one of us have to be running behind him around the church, because nothing that is going on around us is important to him or even seems interesting. We are now at the end of our Christmas term, and can I tell you, not one day for this Christmas term we were asked to come to school and pick him up because the teachers could not manage. So there has also been behavioral improvement that we are having there. We are now able to go to shopping with him even more. Alex is more cooperative now. When he goes into the supermarket, he will walk with us. He's not picking up things, he's not throwing down anything on the floor. Sometimes, he will walk ahead of us, and of course, for safety, we might still be calling him because we don't want him to bounce off everything. He's much more cooperative, and he will pick up and participate in the shopping exercise if we ask him to pick up things as well. And at home, he is less disruptive and destructive, because let me tell you something, we can probably start to decorate house how we want to decorate it now, because you see, first time there are certain things you can't put up in the house, because if you put them up, you know that when Alex passed through, is like a weapon of mass destruction when he mash up some of the things there. So we are seeing much more improvement in a lot of those areas. Now we have placed below a link for the magnesium, the liquid magnesium that we use. Alex doesn't take tablet. There are quite a bit of them on the shelf if you can go search and read up on them. But we're going to put a link below of the one that we use, which is the liquid magnesium, and we're also going to drop a link for the methylated B9 and B12 that we have also used. If you think that this is something that you are interested in adding to your treatment plan for your ADHD child, you can have a discussion first with your doctor and get their feedback before you start the plan. Because guess what? Magnesium can have some side effects when it's combined with other medications. So be careful at all times. Have a discussion with your doctor, your pediatrician. Make sure that you get professional advice before you start any treatment plan with your child. I must say, when we started this magnesium treatment, initially after we bought the first bottle, and we give it to him like 3 days, nothing happens, and we stop. So like some people who, when they go to the doctor and they get a prescription and the doctor say take one tablet 3 times daily for 7 days, and after the first day we take it and we feel a little better and we stop. Yes, I was guilty of that when we started using the magnesium, because what we did, we tried for the first 3 days and we never see any improvement and we stopped. So for a good while we stop, and after we get back into the mode of being overwhelmed and don't know what to do, we decided that, listen, we're going to try this again, but this time we are going to get a longer period to try. So we went about a 30 to 60 day. We did a 60-day trial of using the magnesium every day. Now it depends on the weight of your child. As I said, discuss it with the doctor so that you know that the correct dose is, you are using the correct dose for your child. The bottle may come with, of course, a recommended dose, but depends on your child. Some of the doctors may even run a blood test to see what the magnesium levels of the child are before you actually give the child. So they will know the dosage to give, whether they should give more or they should give less. Because if the child is not getting the correct dosage, you may find that it's not working, and then you may say that the magnesium not working, but you by yourself may not know what amount to give your child. So if your child is magnesium deficient, you may find that they may require much more than the recommended dose on the bottle for it to be effective. So talk to your doctor about that. And guess what now? When we try the 60 days trial on it, what we find is that after probably about 2 weeks, going to 3 weeks, we started seeing more improvement in the behavior. And when we continue to use it for a long while, then we realize that we drop the melatonin. And when we drop it, because he started going to his bed by himself. Oh, that was a surprise for us. Now you should see us, how we dash off figure our bed, because a long time we not get figure our bed early. So those are some of the improvements that we have been seeing from the use of magnesium. So if you are looking for more strategies to manage your autism and your ADHD, you can check out some of our other videos. And remember, parents, be patient with your child and be patient with yourself. Thank you once again for joining us in this another day in the life of living on Autistic Edge. Don't forget to like, comment, share, and make sure you subscribe, and see you in the next video.